The 2024 half-year performance review meeting of the Bono East Regional Health Directorate was held under the theme Building Resilient Structures for Universal Health Coverage and Quality, the Role of Network of Practice and Partners. Regional Director of Health Services Dr. Fred Admakubwatin bemoaned the increase in the number of maternal mortalities, with the region recording 73 maternal deaths between January and June this year.
If you look at maternal mortality, for 2020, the number of women who died giving birth per 100,000 live birth was 95 for 2020. 2021, it was 80. 2022, it was 85. 2023, for the year in review, it was 107. But 2024, 73, very close to the Sustainable Development Goal.
The region also recorded an institutional maternal mortality rate of 6 as at mid-year, with a target of 8 per 1,000 live births.
Then if you also want to look at the institutional neonatal mortality rate, if you look, the target is supposed to be 8 per 1,000 live births. So you look at 2020, it was 6, 2021, 8, 2022, 7.6, 2023, 8.1, 2024, it was 6. And these are what we call quality indicators. These are things that a lot goes into the processes and steps to make sure that you get a better outcome.
Dr. Mrs. Alberta Brechum Nyakung is the Director for Policy, Planning, Monitoring and Evaluation Division at the Ghana Health Services Headquarters. She reiterated the relevance of the network of practice to improving healthcare, particularly in rural areas, as resources are mobilized to help improve quality healthcare.
In the urban areas, there are many facilities in a particular area. So if people want to seek healthcare, it is not difficult. And there are bigger hospitals also in the urban areas. But in rural areas like this is where we even want to form those partnerships, so that even if we are few, we are stronger together and we are more empowered to reach the community. There are areas here where you may even have sparsely populated areas, and even the facilities may be very few and far in between. But if we are able to maximize resources, the little that we have at the local area, making sure that we don't say this is private and this is government, but we work together, we'll see that what we have together is enough to reach the population that we are serving. So this is actually the area where we want to maximize the use of our resources, especially in an efficient manner.
Dr. Fred Admakubwatin was, however, quick to note that as part of efforts aimed at reducing maternal deaths, the region has established a maternal task force to help educate pregnant women on what to do to ensure safe delivery.
We have formed what we call maternal task force, led by obstetrician gynecologists. And their duty is to make sure that all these recommendations that spring up from the audits are implemented across. Every death is a tragic thing. Look, 73 is still high. How can we come so low to about 10 or 11? Because it's not a matter of a mother dying. There are a lot of other social-cultural implications, economic implications, and psychological implications.
Reporting for Joy News, Anas Sabit, Kintampo.